Dr. Jon Quach, good afternoon. You are one of the 10 scientists selected from the AXA Research Fund COVID-19 Call for projects. Your research is about improving the mental health of young children after COVID-19. Could you please share with us the main goals you want to achieve with this project?
Yeah, good afternoon too. So our project really has two main aims. The first one is that we want to follow children up over the next 2 years to understand what has been the impact of social isolation. So in Melbourne, these children have been homeschooled for 20 weeks, and that we want to know that now that they are back at school, what has been the impact on their mental health, and how does this and what does it look like for the next 2 years? And we also want to understand what's been the impact on their academic achievement, their executive functioning, as well as the mental health of their parents. The second part of our project is really wanting to understand whether a classroom-based mindfulness intervention can improve the mental health of these students. So mindfulness is an approach where it's about teaching students about the importance of maintaining focus, about their emotional self-regulation, and really being in the moment and being able to take advantage of their learning environment. And that we want to know where this simple intervention that we've developed, where teachers can teach students about these skills, can actually improve the mental health of these students post-COVID.
Thank you. That's very clear and very interesting. And hearing about mindfulness at school might really make a difference for these children in that situation. So, regarding the findings that you will get, how do you plan to make them as useful as possible to the different people involved, namely parents, pupils, and teachers?
Yeah. So. I guess one of the main things about the intervention that we've developed is that we've really thought of teachers from the very start, and we've worked with teachers to create the program and to make sure that it is something that is simple, that can be used within every classroom, regardless of where teachers are located, and that it is low cost. So we already hope that if it's shown to be effective, that teachers can complete the training and to be able to implement it within their settings. And our team really has a principle that we hope to share as much as we can, as soon as we can as well. So we really want to engage with our schools, with the parents, as well as with the general public, so that we can share our findings as widely as possible. And that part of how we might do that is potentially through a series of fact sheets that we'll create along the way. So for each time that we produce or have a new finding, that not only will we have a scientific paper, but we also want a public paper that can be widely used by teachers, by parents, and that we hope to be able to engage students as well.
So there will be lots of help coming from this research, for sure.
Yeah.
Thank you very much. I have a last question. Wanted to ask you if you had in plan to focus on specific schools, maybe, and or on certain types of families, and if so, which ones and why?
Yeah, so our study is really wanting to focus on schools which are in disadvantaged areas of Melbourne. And the reason why we're focusing on these schools is that Australian data shows us that children who are commencing at these primary schools are 3 times more likely to have social and emotional difficulties as they start school. And that these are for a variety of different reasons, but the risk is still there, that they're 3 times more likely. And early findings also suggest that these gaps may have increased and may have got worse because of the social isolation that they've experienced because of COVID-19. And that we really feel that if we can understand what the impact has been on these students, but also understand how we can intervene and support them, that we can really start to address the impact of COVID-19 in the long term, so that these students can have better social and emotional skills, emotional regulation skills, and ultimately that they can have a healthier and happier first few years of school, which we know are really foundational skills to lifelong learning and well-being.
Well, thank you. A lot to come for a better well-being and mental health of young generation then with your project. Thank you very much for your time today and for sharing all this information, and all the best for this project. We'll be very happy to be back in touch with you soon to learn as soon as you have findings to share with us. So again, thank you. Congratulations for being selected, and keep in touch soon.
Thank you.
Bye.
Bye.
Bye, Dr. Quach.